Good afternoon, everybody. Welcome to this most recent COVID briefing. I said on Monday that we would be considering on Tuesday, which we did, whether or not we should be moving forward in relation to the lockdown. There was no guarantee then that we would, and we therefore considered it with great care at the CCA meeting yesterday afternoon. And I emphasise that it was a decision that we made after due consideration. And I'd also like to make a general comment. The work of Dr. Brink and her team and many other people is excellent. It's first class. But the responsibility, the credit for any decision is theirs because of the input they give us. But the responsibility is that of the politicians. We make the decision. So therefore, if you disagree with them, then you should direct your comments towards us. And I don't mind you directing them towards me as chair of the authority. But let's move on and let's say where we are in relation to the lockdown. Now, firstly, I'll deal with Alderney because Alderney is in a different position to Guernsey in the sense that it has only had one case. That case is well under control. That person, thankfully, is making a good recovery. And Alderney has the 14-day restriction between movements from Guernsey to Alderney. So Alderney will be moving into phase one of the lockdown tomorrow. That's Thursday, the 18th of February. Guernsey's position is somewhat different. We will be moving to lockdown, easing of lockdown, and to phase one on Monday, the 22nd of February. So that is, 5 days' time, 5 days' time. We will be moving then. Now, in relation to that, some people will say perhaps we should have moved tomorrow or earlier. Some people will say that we should have waited a bit longer. Now, this decision is not a compromise. We don't compromise with safety. Our paramount and overwhelming consideration always has been and always will be the safety of the people of the bailiwick. So therefore, we've made that decision on the basis of what we believe is credible evidence and as a circumstance, as a move forward that we believe that is genuinely in the interests of the bailiwick. Now, we're seeing low case numbers every day. Again, the figure for yesterday was low. Now, that's excellent, bearing in mind the very high numbers that we got immediately after the lockdown. Now, that is a tremendous achievement in relation to bringing down the transmissible variant under control. That's down to Dr. Brink, her colleagues, to many other people, and to you, the people of the bailiwick. But if we're going to maintain that progress, we have to be, that word that Dr. Brink uses a lot and I use a lot, we have to be vigilant. You can't take your foot off the brake in relation to that. The CCA members still have concern, and that's why we delayed phase one until Monday. But our very expansive testing programme means we're testing high numbers of people from a wide range of areas. And whilst this is thankfully not revealing that there are many cases, it's still revealing some where the source is not clear. Now, also, we have a workforce testing programme that's regularly testing the staff of a number of essential services. And this is being expanded to more workers in the forthcoming days. Now, as I said, the CCA has agreed that we should wait until Monday in relation to Guernsey. We're going to expand our testing. We're going to get greater visibility still on where this virus is. Again, I emphasise this is not a gamble. We do not gamble. The safety and security of everybody is paramount to us all. But Monday is the date. And unless we see any serious and unexpected change in the trend, that's the date that we will move forward with. We'll keep a close eye on the situation, but as I say, prepare in Guernsey for Monday being where we move to stage one. We're now in a good place, as I said before. New cases are few and active case numbers are falling. Now, stage one is the first real step into the lockdown. We had a little bit of a twiddly bit between last week and now. Step back towards normality. But there's only so long that we can expect people to wait, to be locked down, to suffer the burden of that. And we have to balance whatever risk there might be to the community. And we believe there always will be a risk, but that it's minimal and has to be balanced against our move forward in relation to stage one. Now, as I say, we can only do that, we can only maintain it, and we can only continue the progress if everybody does everything that they're supposed to do. Do not think we are there. We are a long, long way from there. And we certainly don't want to go back from stage 1. We want the next move to be, after a due time, due consideration, into stage 2. As I say, Alderney's in a different situation. We're pleased to be able to say that they can move, as I've already said, into phase 1 tomorrow. Now, my colleagues, Deputy Salisbury and Breward, and our Chief Executive, will explain what the rules for stage 1 are for businesses, socialising and recreation. And in a moment, I'll just be handing over to Dr. Brink. But I would just like to say this. This is a step forward. It is a very cautious step forward. We're putting our toe into the water, but not of uncertainty, but of moving matters forward. Dr. Brink.
Thank you very much. And if I could have the first slide, please. So I'll just talk to the slides. They don't seem to be come onto the slide, onto the projection as far as I can see. But I'll give you an update as to where we are. So we now, since the 22nd of January, have had a total of 496 positive cases. And of those, 373 are now closed. Overwhelming majority of those have recovered, so 372 have recovered, which we're very pleased to say, and 1 has sadly died. But with that, we have 123 active cases. So that's 25% of active cases of that total. So it's an encouraging situation to be in, but as Deputy Fairbrash said, we're not there yet. So if we then looked at what would have been the next slide, but I'm going to carry on talking around these, is that the case breakdown is something that we look at. So we look at unknown community cases, we look at contacts, and we also brought in the category of planned workforce surveillance. So with the unknown community cases, these are usually cases that come up symptomatic. So they will present to one of either to our helpline, to primary care, or to our emergency department. They'll present symptomatic. But what we also look at is our contacts of cases. We specifically look at the care home sector because we know that's a particular area of vulnerability, but we also do our planned workforce screening. So these are people with no symptoms. So because they're in public-facing roles, we test them in large numbers to see if we can detect any asymptomatic infections. This is to stop bubbling up of little clusters of cases. So if we look at the last 2 days, so on Monday the 15th, we had 1 case that was detected through contact tracing, and we had a further 2 that were through planned workforce screening. Now the planned workforce screening are community cases, but they're detected because they're asymptomatic through proactive screening. And so there are cases that we need to focus really carefully on. If we look at the situation yesterday, we had 1 unknown community case that was a symptomatic person who sought medical attention, so one that we need to focus on carefully, and 1 contact. So the overall picture is encouraging. We're going the right way. We are seeing the number of active cases decline, but we still are seeing these individual cases we really need to focus on as we move forward. And again, we would have projected a graph, but what it shows is that the number of active cases are going down and the number of recovered cases are going up. So just the type of trend that we'd want to see. Now, I wanted to spend some day today also talking about the exit from lockdown and the importance of the surveillance program in the exit from lockdown. So, as I've said before, with the exit from lockdown, we have our track and trace system, we have our testing program for symptomatic testing, we have our triggers that we look at, the adaptive triggers for us to go forward and backward. But critical to this at exit from lockdown, we've also got our enhanced surveillance program. So that enhanced surveillance program is going to look at a number of different groups of individuals and is key to our safe exit from lockdown. So if we look at those groups of individuals, so not only are we looking at probably obvious are the health and care groups, so that's not only our doctors and nurses, community workers, social workers, carers in the community, so all of those groups of individuals. So we're looking at them for part of the surveillance testing, again, to see if we can detect any asymptomatic infections. But there are also other groups of public-facing roles that have been so integral to the progression of our to the maintenance of our island infrastructure whilst we've been in lockdown. And indeed, as we progress out of lockdown, they'll continue to play those vital roles. So those include police, taxi drivers, bus drivers, police, teachers, so all of those groups of individuals, delivery drivers that are keeping our islands supplied with goods, and places that we perhaps don't focus on so much, but the staff working in isolation hotels as well. So all of those individuals, we're looking at doing surveillance testing to detect any asymptomatic infections, to enable us to detect those infections and manage any small clusters associated with those. Along with our surveillance testing, you may well have heard me talk about surge testing as well. So we're using our testing capacity to test around areas of interest. So if we detect 1 or 2 cases in a particular sector, in a particular home or in a particular area, what we can then do is we can then go and really focus and put some testing around that to prevent those onward chains of transmission. And that's how we'll bring the whole matter under control. And that is vital as we move forward. Now, I have been asked are we looking for absolutely no cases over a defined time frame before we go from lockdown to stage 1? The answer is no, we're not. What we're looking for is are there any cases appearing? Are we happy that we can control them through our track and trace and through our expanded testing? So we're not looking for defined number of cases, and indeed not between stage 1 and stage 2 either. Once we get to stage 3, which is the opening of the whole bailiwick, we'll have a hard look at the situation then. We'll also take into account what proportion of the population are immunised. So we'll make a decision at that stage. So I hope that clarifies for those of you who wanted to know more information about that. So I'm going to pass back over to you, Deputy Fairbush. Thank you very much.
Thank you very much, Dr. Brink. Now, stage 1 will mean new rules for businesses. Some businesses will be able to operate, many will not. But even those that can, the rules will be strict. And my colleague, Deputy Salisbury, will take you through that.
Thank you, Peter. Now, as we move through our exit from lockdown, just like last time, at each stage, the emphasis will be on mitigating the risk of virus transmission. The risk will increase as we open up the economy and relax restrictions on the community. So we're starting gradually and seeing how things go before opening further to stage 2 and then back to where we were before the 23rd of January into stage 3. Now, unlike last time, with surveillance testing that Dr. Brink has just described, we will be able to get a better idea of the effect of the changes we make and determine a suitable time to move to the next stage more easily. Now, this means that the first steps we're taking are to allow the resumption of low-risk activities. That is, activities which are not considered to significantly increase transmission levels. So from Monday, businesses will be able to resume activities only if they can meet the principles outlined in stage 1. Now, before I go through those principles, the first point to make is that if your business is able to operate remotely, then you must continue to do so. The message is still stay at home if you possibly can. Now, if your business can't work remotely and it's able to have no direct contact with customers, workplaces will be able to operate as long as they adhere to the following rules. Up to a maximum of 10 members of staff for outdoor sites and up to a maximum of 5 members of staff for indoor sites where the work can't be done remotely from home. Whether indoor or outdoor, work will only be permitted where social distancing can be observed and sufficient hand washing or hand sanitizer facilities can be provided. Deliveries and takeaways are able to operate within these same parameters and requirements of stage 1, and takeaways can be collected, but that will have to be done outside. House removals will also be accepted under strict protocols. Businesses are expected to operate responsibly in the interests of the community as a whole, with a particular emphasis on ensuring all staff displaying symptoms, however mild, stay at home. This is hugely important and something all business owners and managers must. There will be a requirement for businesses to notify the States of Guernsey of their intention to operate and to maintain records, demonstrating that they are working to a clear method statement. Detailed guidance will be on the business section of the COVID website, and the Chief Executive will provide more details about the process for businesses to follow to notify the states of their intention to operate in a minute. The last thing I'd like to say is that it's really so important that the business community work with us on this. We want to move through the stages as quickly as possible, but we'll only be able to do so if everyone follows the rules. As we said before, while it's natural for businesses to try and find workarounds to allow them to operate, please respect and stick to the spirit of what these rules are trying to achieve. It's for everyone's benefit that we do as it means we will be out of this sooner rather than later. Thank you, Peter.
Thank you very much, Heidi. Now, on that same theme and giving more information, over to our Chief Executive, Paul Whitfield.
Thank you, Deputy Fairbrush. Good afternoon, everybody. As stated by Deputy Salisbury, there will be a requirement for businesses to notify the states of their intention to operate if they're able to do so within the rules of Stage 1. The notification system will be web-based. When businesses complete the form and provide their details, they will have to self-declare they understand and will adhere to the public health regulations and guidelines that apply in Stage 1. Once notification has been made, the business will be able to start operating under the new guidance from the date that Stage 1 comes into effect. Therefore, once the notification form has been submitted, businesses will not need to wait for confirmation, as the form itself is the self-declaration of compliance. They must, however, wait until tomorrow if in Alderney and Monday if in Guernsey, unless, of course, they are already in operation now as either an essential business or a lone worker. The Office of Environmental Health and Pollution Regulation will be coordinating compliance and carrying out monitoring checks to ensure businesses are fulfilling their obligations for how they must operate in Stage 1. We have updated the contents on the business section of our COVID website, and I would encourage all businesses to review the details from there. The form is live now, so for businesses in Alderney that want to operate from tomorrow, when that island moves into Stage 1, they can complete the notification today. Businesses in Guernsey can also complete the form today if they wish, but obviously, as stated, does not operate until Monday when Guernsey moves to Stage 1. I just want to briefly touch on what Stage 1 means for education, as we know how important clarity about this area is to families and our children and young people. In Stage 1, there will be no change to our existing arrangements for education settings and preschool. This means that they will continue to be open for vulnerable students by invitation and for the children of essential workers where both parents are classed as essential workers, or a lone parent if in a single adult household where that single parent is engaged in essential work, which must be completed away from the home. There is, however, one change that I should highlight, and that is that a childminder will in Stage 1 be able to work with one family if they bubble together. And Deputy Broad will be explaining bubbles again to us in a moment. Limiting our numbers in our schools and early years setting remains really important, as we need to keep as few people attending as possible at the moment to support our efforts to move through the exit stages as quickly as possible. I know how closely our public health and education teams are working to plan how best we can open all schools and settings to all students in a coordinated and safe manner within the Stage 2 of the exit framework. More information will be released about the education pathway to the Committee for Education, Sports and Culture shortly. Thank you, and I'll hand back to Deputy Fairbrush.
Thank you very much, Paul. Now, Deputy Brewer will explain in just a moment, because there are going to be new rules for recreation and socially what we can do. And Paul Whitfield has already highlighted that Deputy Brewer will be referring to that and mentioning bubbles. Al.
Thank you very much, Deputy Fairbrush, and good afternoon, everyone. From Monday, and in Alderney from tomorrow, all households will be able to bubble with one other household. We are all familiar with bubbles from our experience in the first lockdown, and this is exactly the same. Two households can bubble with each other. Once you bubble with another household, that is it. You can't change the next day and bubble with someone else. It's just those two households. Already, this is in place for those who meet specific criteria for support bubbles. And if that's you, you've already bubbled. You must keep that same bubble. Stage 1 is not an opportunity to switch over to a different household in a new bubble. If you're in a bubble together, there is no need for social distancing. You can meet indoors and for as long as you want. You're all in that bubble, and because you're in that bubble, that means you can also meet outside without observing social distancing. You can meet indoors, outdoors in your garden if you have one, in the park, on the beach. 2 households, 1 bubble, no one else, no social distancing. Of course, if you're out in public on the beach or on the roads, albeit in your bubble, be aware of others. So keep your distance of 2 meters and wear your mask as necessary. For those not in the same bubble, we are also permitting outside gatherings of up to 5 people. That's 5 in total, irrespective of age. Children and babies count. So if your outside gathering has some people from within your bubble and some from outside, the limit is still 5. You must socially distance from those outside your bubble, and we strongly advise you wear your face covering. We know from previous lockdowns that bubbles work really well for a lot of people, but for others, it created tough choices and meant some people were left outside of a bubble. By being able to meet with more people outside, provided it's done carefully, we hope more people are able to benefit from this chance to again socialise. We're extending the time you can spend outside for recreation, whether that's on your own going for a run or for going on an outdoor gathering. It's up to 4 hours. And in this weather, that's probably more than most of us would want to do anyway. When we say outdoors for groups of 5 people, which are non-household bubbles, we don't mean your garden. We know in some cases those are small places. You'll end up close together, and when the rain starts coming down, it'll be tempting to pop in the house just this once. But unless you're in a bubble, that's not the idea and does not help us minimise the risk of spreading the virus. Remember, as Deputy Fairbrush said, stage 1 is an important first step out of lockdown. It must also be a careful step. The virus is still here on our island. We must tread lightly, or we will only find ourselves stepping backwards into the current tougher restrictions. Finally, we have always said that we'll be informed by the evidence in shaping our vaccination programme and to make sure that those most at risk are vaccinated first. New evidence was published yesterday looking at how combined factors such as age, weight and underlying conditions may affect the risk of an individual becoming seriously unwell. And Dr. Brink and her colleagues have been looking for us at Health and Social Care at how this can be applied to the bailiwick. Our vaccination programme will have already captured very many of these individuals, but where it hasn't yet, we'll be taking steps to make sure that they are vaccinated as soon as possible. Thank you, and back to Deputy Fairbrush.
Thanks very much, Al. Questions and answers now from the, questions, and then we'll try to answer those questions from the media. So could I ask the media, please, to put their hands up and then I'll call you accordingly. I'm just looking. I know can't see any hands up at the moment. I'm sure there'll be lots of questions. Yes, Matthew. Matthew, I'll start off with Matthew Leach. Matthew.
Hello, Matthew from the Bailiwick Express. Can a multi-occupancy rental or a hotel accommodation be considered as a building a single bubble?
Well, the answer to that is I believe it can, but I think Dr. Brink, who's been dealing with single occupancy, multiple households, do that. But yes, if it's a multiple occupancy, let's say staff accommodation, that's one household. Dr. Brink, do you want to add anything?
Yeah, so I think we'll differentiate between a household and a hotel setup. So if it's a multi-occupancy house, then yes, that's a single household. If it's individuals living in a hotel, then I would say no. But if it's an individual household, then I would say yes.
Thank you. Hopefully that's clear, Matthew. Mark Osier from the press. Mark.
Yes, good afternoon. I understand that an appeal went out for people living here who weren't actually residents, who might have wished to have a vaccine. I'm wondering if many people have contacted you about it, what age brackets they're in, and what happens next?
Yeah, I think I'll come to Dr. Brink first, because that is a good question, because that has been in train now for a bit of time. Dr. Brink, do we know the answer to Mark's question?
So there have been a considerable number of people coming forward. We don't have the exact numbers. We're looking at that. And we also don't have the exact age bracket, but we're going to pull all that together so we can look at how we can deliver that programme.
Thank you very much. Hamish, your question, please.
Yes, Dr. Brink, I wonder if you could give an indication for the kind of capacity that we might have for testing the various cohorts as part of the enhanced surveillance. Have you got an idea about how many delivery drivers you'd be able to test, for example, and the whole number?
So we can test over 1,000. We could go up to 1,500 a day. And the groups that we're looking at, we're stratifying them either for twice weekly testing, for once weekly testing, or even fortnightly testing. And it depends on the group. So that's a piece of work that we're doing at the moment. So delivery drivers are one group of individuals. We consider them absolutely essential to our island infrastructure, but they're also care and residential home staff. There are other frontline retail staff. So it's a number of groups of individuals that we're looking at. So capacity of 1,000 we can cope with fairly easily, up to 1,500 we can still cope with, but we'll only use our testing capacity as required. So we're defining exactly what's required by group. At the moment we're doing some surge testing around particular areas, and that forms part of the tail end of an outbreak control, as you start then mopping up any residual infections to stop them flaring up again. And then we'll move next week into a more proactive surveillance program on a population base rather than focused on surge testing. At the moment, we are also doing some surveillance testing on teachers and children going back into the school environment. We know we had a lot of activity within educare, a lot of cases within children and teachers, and it's focused on that we're doing that testing program. So we're trying to stop those clusters of infections reoccurring.
Thank you very much. Ewan Duncan, your question, please.
Hi, good afternoon. Ewan Duncan from BBC Guernsey. Are we able to get an update further to Monday's briefing about the unfortunate death, and if that person had any underlying health conditions, and also an update on hospital cases and those in intensive care, please?
Dr. Brink, I think you're going to be cautious about disclosing any information, aren't you?
So, as always, we respect the family and our thoughts are with that family, and we don't intend disclosing any further information on that particular person that died. I don't think it's fair on the family, and we need to respect their privacy at this really difficult time. With regard to hospital cases, today we've got a total of 7 cases within the hospital. One case remains in our medical high defence unit in our intensive care, and 2 of the other cases are merely for general care from the care and residential home. They're due to return to the care and residential home at the end of this week, and there are a few other patients that are doing well that we're expecting to discharge imminently.
Thank you. Jim Delbridge from Ireland FM. Jim.
Thank you, panel. As we experienced last year, many people during lockdown took advantage of being at home by doing the kind of jobs they've been putting off for ages, like fixing that slate and decorating that and painting that wall, etc. Is there any indication from the panel when it's likely that places such as building merchants, DIY stores, garden centres, there might be a relaxation so that people can take advantage again and do that much needed work? Thank you.
Heidi?
Yeah, it's a good question. I can relate to that. I think what we're looking at is probably stage 2, but it won't be completely back to normal. And what we used to be, somebody be able to go in and come out, it'll have to be social distancing and other measures put in place, but it won't be for stage 1.
Thank you. Matthew Leach.
Thank you. I'm going to return to a question I asked on Monday about antenatal scans. The Society of Radiographers in the UK supports a mother's ability to record a 10 to 30 second clip of a scan. Will there be any leniency to allow this in Guernsey during the current lockdown and restrictions?
Thank you. Dr. Brink, are you able to answer that? Or is that one to take advice from Dr. Raby?
That is one I'd have to take advice from Dr. Raby. He is in charge of the hospital infrastructure, so I really would have to take advice from him, and I wouldn't want to preempt anything he wanted to say.
Okay, could we return to that, Matthew, on Friday, and hopefully you'll be able to get the information from Dr. Raby between now and Friday, because I agree it's a very valid point and people are interested in that. Thank you for raising it, Matthew. Mark Osier from the Press. Mark, your question, please.
Yes, I emailed Dr. Brink earlier about this. I don't know if she's been able to have any luck, but I'm just curious with the comparison to living with COVID as we might live with flu in the future. I wondered if you could give an indication of the cases of flu that we get in Guernsey over the last year or two compared to the number of cases of COVID we've got. And do you think it's reasonable to compare the two as to how we might go forwards?
I think I could write a PhD thesis on that one. So I think, first of all, just to answer your question specifically, we've tested, we've had no flu isolates this year at all, and we do test. Now, that's very much in line with what's happened in the UK. They're seeing very little flu activity there as well. So, for example, every single COVID positive case, we test for flu as well, as they do in the UK. And in the UK and ourselves, we've seen very little activity. In addition, our emergency department will test admissions as appropriate for flu. And again, we've seen nothing there. So we haven't seen a lot of flu activity this year. So that specifically answers your question on flu activity. The wider question of will we have to live with COVID as we live with flu, I think possibly in the future, but I think that answer is, to answer that question with any certainty, we need to, first of all, immunize our population. We need to see the impact of what these variants are. We need to see whether that will mean that we have to have an annual 2-yearly booster system. But there's no doubt that as we immunize in our community, we will profoundly reduce the morbidity and mortality associated with COVID. So there is a time that we are going to have to find some sort of equilibrium. I just think it's too soon for us to say exactly what that time will be and exactly what that equilibrium will be. But yes, there's going to have to be something.
Thank you very much. Hamish Alsbury, your question, please, Hamish.
Yes, it's a question about the face coverings guidance and now the legislation. A question from a viewer, really, that there's some concern that people who have an exemption would feel stigmatised by needing to have a lanyard, and some concern that they may leave the house less for fear of what may be said to them or how they may be seen in the community. And this person was asking if there was any assessment of the social impact of the legislation to do with face coverings.
Hi, did you want to pick that one up initially?
I can do. I think it's a really valid question, and I have said, and when we brought it in, really trying to tell people just don't reach conclusions just because you see someone without wearing a face mask. We know 99.9% of people will want to follow the regulations, and if they're not wearing a mask, it's very, very, very high probability it's because they can't. And I think people need to have that mindset now. And not worry about that. I hope it won't affect people. I think hopefully if they listen to that and hear that, it makes them feel more assured. But we probably won't know until we go further down the line when we survey and we find out more about how it is impacting people. But if people do feel that, please let us know, because I think it's really important that we do know what people are feeling, what the impression is out there. But hopefully it's saying, work on the basis that everybody will want to follow the law. So anybody not wearing a mask, they have a valid reason for doing so.
Thank you very much, Shadi. Absolutely, I agree with every word of that. And I don't think, I may be wrong, I don't think we've actually had a case yet where a fixed penalty notice has been issued. And we're going to ask Mr. Hardy, Head of Law Enforcement, to be on the panel on Friday. We'll be able to deal with some of those questions. Ewan Duncan and then Jim Delbridge. Ewan.
Hi, I've just a question for Dr. Brink. I was just wondering, the planned workforce screening numbers, is it a concern that we're still finding these out there? Because obviously they're from people who mostly in contact with the large majority of people in the community. And I know you touched on it in your speech, but it might be worth recapping about the 7 to 14 days that's been quoted of having no new community seeding cases before, but that might slightly be superseded now.
Dr. Brink.
So, with the planned workforce screening, the individuals that we've identified as positive have all been linked to areas where we know that there's been COVID activity. So, of course, it's of concern when we get people positive through screening, but they are linked to areas that we know there's been COVID activity. So I think the aim is then to detect these cases and stop onward transmission, which is why we wanted to do it. So if you look at the approach, is lockdown will get rid of most of those infections. As people come out and have interaction, you'll then have any residual infections potentially spreading out again, which is why we're doing those screening processes. So I think those infections have occurred from areas in which we know there's activity, which underlines our cautious approach. So with regard to your second question about having absolutely no cases between the various stages, between lockdown and stage 1, what we're doing is we're looking for cases of public health concern. So yes, when we had a symptomatic case yesterday, which had presented and tested because they were symptomatic, we focused really carefully on that case. We subsequently have identified some links with that case, but there isn't a clear case contact link. So that's really important for us. So that was a symptomatic case. So that's so as we progress from lockdown to stage 1, if there are ones of concern, we'll look at whether we think we can control that or whether we feel this represents a population-based risk. And again, similar ethos, similar logic for between stage 1 and stage 2. If you recall, stage 3 is back to our old phase 5. So that's back to a community where we have absolutely no NPIs. And we'll have to look very carefully at that. And we'll have to take into consideration the level of our population-based immunity at that time, so how many people have had vaccine, and also the emergence of the variants, because we'll be into a population with no NPRs, so no social distancing, and so the old phase 5. So we'd have to be very, very careful. Our progression to that stage, if there was viral activity and we didn't have sufficient level of population immunization. So the increasing risk makes us more stringent with the amount of viral activity. So I hope that answers that question.
Thank you very much. Jim Delbridge.
Thank you, panel. A question from a listener. They've heard that a number of people tested have had inconclusive results. Now, my question then, is this true? Is it a myth? And if it is true, how do you record these results? Thank you.
Dr. Brink chomping at the bit to answer that question, I can see.
Yeah, so those are indeterminate results. So basically what happens is that when we test against multiple targets in the virus. And if we get, say, one target and not all of the targets positive, we can't say that's results negative. We'll say it's indeterminate. Now, there are a number of interpretations for that. It could be someone who's developing an infection. And if they're developing an infection, they're on the way up, as we say, they're getting more infectious. Or it could be someone who's coming down the other side and they're resolving an infection. So with those indeterminate ones, and we quite frequently see those in clusters. So we know that there are the people who are incubating and developing an infection, resolving an infection. We'll take a second sample from that individual. We'll ask them to come for a second sample, and that will enable us to provide resolution as to whether this was a resolving or now resolved infection, or whether this was an evolving infection. So this is particularly important in outbreak management, that you don't ignore those samples. So we know that people don't like to get an indeterminate result, but these are important because it helps us control the outbreak.
Thank you very much. Mark Ogier.
Yeah, this is a reader's question. If someone is asymptomatic, for how long can they pass COVID to another person?
Thank you. Dr. Marie.
So an asymptomatic case, if we get someone who's asymptomatic, we don't know when they got their infection. So we'll go back for the 2 weeks prior to them becoming positive and look at those areas for contact tracing. We'll then take the day that they've had the test as day 1, and we'll do a further test on day 10. With regard to a symptomatic person, for example, we'll take the time that they had symptoms. We know that people will be infectious for 48 hours before, and we'll count 2 days back. So with an asymptomatic infection, they are difficult to manage, and we do have to go back 2 weeks for contact tracing because we just don't know when they became positive.
Thank you. Matthew Leach.
To get on whether or not any vaccinated people have caught COVID, and if so, could these people potentially be contagious?
So yes, there are people that are vaccinated that have caught COVID. And just to remind you about the aims of the vaccination program, it's to prevent COVID-associated morbidity and mortality. The prime aim is not to prevent transmission. There's data now emerging that the vaccine will reduce transmission, but we don't think it's going to be 100%. So we have had people that have been fully vaccinated that have caught COVID. None of them have been unwell or severely unwell. And so that's important from that point of view.
Thank you. Hamish, your question, please.
Yes, Dr. Brink, maybe jumping ahead slightly, but I wonder if there is a minimum period of time you would expect between starting stage 1 and considering to move into stage 2.
We've debated that long and hard, but I see Dr. Brink is... Yeah, sorry. I think... I can start with that. The answer is there is no fixed time. We will have to monitor stage 1 very carefully, because the move from stage 1, which is a limited opening up, to stage 2 is a significant one. You've heard what Dr. Brink has said in her early answers, both today and earlier. So therefore, it could be a period of time. But whether it's 2 weeks or 3 weeks or whatever, I think it would be just speculating at this particular time. We will move as quickly as is when the safety elements are all there, when we feel as an authority, having taken the advice from Dr. Brink, that we can do so. It's a very fair question. I don't think we can be any more precise, but Heidi's going to add something.
Yeah, I just want to reiterate what I said in the speech earlier. We're a bit better placed than last time because we've got that surveillance testing that Nikki was talking about. I think last time we weren't sure. We were saying, right, we need to be careful and very cautious. But even when we had what appeared to be 0 cases, we didn't know how many asymptomatic cases there were out there. So we're in a different place. Now we can go hunting for asymptomatics in a way that we couldn't before, which gives us a better picture and gives us more assurance about moving to the next stage.
Al, you had your hand raised. Do you want to say?
Yeah, it was just to add, I think also from the community's point of view, we don't really want to move backwards. So we've just a little bit more, we'd rather move cautiously forward than rashly go forward and then have to jump back a stage. So I think that's how most people would like to approach it.
Okay. Hamish, your question.
Yes, just to follow up on something that Deputy Brouard said in his opening remarks about the new information that led to the UK government changing the list of shielders and increasing the size of that list. I wonder if there's anyone here in this bailiwick who would see themselves as, if they were in the UK, they would have been added to this list. Should they change their approach to anything? Should they be more concerned about this change in approach by the UK government?
Deputy Brouard, do you want to say anything on that?
Well, I think it's a welcome approach from the UK government. It just shows that we are all governments are watching the data as it comes through, and we're reacting to the science as it comes forward. It's good news if we can get an even better cohort vaccinated first. Then that is good, and the island will follow along. And I think Dr. Brink and her team will be looking at the data now. As we said earlier, a good chunk of people who would fall into this category have already been vaccinated. So we're just looking at the others and how we can bring them up forward. I mean, there's nobody being precious on this. We're just trying to make sure that we do the right thing and vaccinate the most vulnerable first.
Thank you. Matthew Leach.
A question about stage 1. When referring to 5 people indoors, does this include the occupant of a house if tradesmen, for example, were to work, or an estate agent doing a viewing, for example, in a property? Would these situations be allowed?
Heidi, do you want to deal with that?
Well, we're talking. Well, no, it wouldn't. It doesn't apply to that at all. In terms of. Was that, sorry, can you say, was that about bubbling or within people working within a house?
I think
it's a working situation.
Working inside.
Well, it should be working is a number of workers who are there. You're not allowed to, if you're doing anything, you're not allowed to interact with any members of the public. The whole point of this is if you can work away from members of the public, but you can do so that in your work by socially distancing.
Yeah, what you can't have is, say, 3 workers. It's got to be the 5 workers. They've got to be distanced. And again, as explained by my colleagues, and the guidelines will also be well published. Who else has got a question? Hamish.
Sorry, one final question for me. Just a few members of the public asking, at what stage gyms would reopen and when people who like to play golf will be able to return to that pastime.
Heidi?
Well, from a golf point of view, there shouldn't be any reason why people can't socially distance in their gathering, but of course clubhouses and places like that will be shut, so they won't be able to do that. In terms of gyms, that won't be for a while, because the issues are then of aerosols and activity, which we spoke about last time. So gyms won't be, I don't know whether they'll be to stage 2 or probably more likely stage 3, I suspect, but we haven't got to that point. But those are more high risk, so they won't be in the next, well, certainly aren't in this stage, but we have to think carefully whether we would want to include them in stage 2.
Thank you. I don't see anybody else from the media with their hands up, so I'm assuming those are all the questions. If they are, Matthew, you've got a question, yeah.
Sorry, just going to drop one last one here at the end. I just was getting my head around it. So takeaways and non-essential retail can be open for deliveries in stage 1, but places like B&Q and garden centres cannot be open for deliveries. What's the difference there? Can that just be explained?
I think, Heidi, do you want to add something?
Yeah, well, the deliveries from a takeaway point of view, they have to be outside, but the difference is the garden centres would have to have... They're all public faces, so people have to go around, pick something up and take it away, and that is the difference here. It's not stopping them from doing deliveries, but it is stopping people from milling around inside shops at this moment in time. That will be something for stage 2 when we're comfortable about going there.
Paul, you've got your hand up. Paul Whitfield.
Yes, I know it's been said a few times on the panel, but I think it's really good to make it clear that stage 1 is still preserving the stay at home if you can, limiting the amount of socialising. These are tentative steps, as Deputy Brouard said. It's stage 2 that we can take stronger steps to opening up. Again, as Deputy Salisbury has said, that will be done under social distancing requirements and all that. But and my final point was to say, we, I think, are collectively clean, and listening to what Deputy Ferbrache said in his opener was the CCA make the ultimate, politically make the ultimate decision on the advice given. And that at the minute is to get through stage 1 as quickly as we possibly can. So my finishing point on that is adherence and patience to stage 1 is really essential for us to get to stage 2 as quickly as we can.
Thank you. Deputy Salisbury.
Yes, thank you, Peter. I think it's very important that we're asking lots of different questions of what if and various scenarios. Now is not the time to be able to give very specific details and specific circumstances. Do ask that people look at the guidelines which are on the website and are clear. But if in doubt, just don't do it. The guidelines are very clear in telling you why we're doing what we're doing and what and the reasons for it. And I think if people can get that, they can probably work out each scenario whether they can do something or not.
Thank you. Thank you. Questions for the panel. For the media. They've been good questions as always. I'm grateful for them. But just taking up a couple of points that my colleagues have made. Now, businesses, and I'm sure they will all comply with the rules, but they must comply with the rules. There's no trying to expand the rules or just say, can we just do this? Can we do that? We're allowed 10 people on a site, but actually if we could just have 12, we could do this or we could do that or the other. Because the answer will be no. You're allowed 10 people in the circumstances, and you won't be allowed 11 or 12, because if you're allowed 12, then somebody else will want 13. This is a gentle, careful moving into the next stage, because again, as Paul Whitfield has said, the sooner that we can move from phase 1 to phase 2 depends on the behaviour of the people in phase 1, together with all the scientific and medical advice that we will receive. So, and also, please, 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 do not, as an employer, if you've got somebody who's got a mild symptom or any symptoms and you're worried about your numbers, whether you're 10 or you're 5, do not encourage or cajole those people to come to work. They must stay at home. They must report. They must be tested. Do not, in the exigencies of business, in any way encourage or try and persuade those people to work, because that will mean we'll move backwards. Want to move backwards. That's why we're taking a relatively cautious approach. And finally, I got my letter today about phoning up for my examination. I was surprised. I thought I was the only under 30-year-old that got it. Well, if only if I was so lucky. In fact, I've made, and I'll be having my first vaccination at 6:30 on Saturday. Now, I'm not expecting acclamation in crowds, but I'm just making the point that as soon as you get your opportunity to contact the authorities to arrange your vaccination, please do so, because that is one of the large measures of us getting out of this situation sooner rather than later. But I'm grateful to my colleagues on the panel, and I'm grateful to you for watching and listening, and to everybody else. And we'll be back with you on Friday. Thank you very much indeed.